Hi, I'm Dr. Jae-hee Moon, a fertility specialist here at Mariae's Hospital. In today's Maria School, we will talk about what infertility is, what tests are needed for diagnosis, and what treatment options there are. Infertility is a condition in which a couple is unable to achieve pregnancy even after 12 months of unprotected sexual intercourse. In such couples, we recommend visiting fertility centers to receive full testing and specialized help. No, not really. Women aged 35 years and older are advised to visit fertility centers after 6 months of infertility. There isn't any strict guideline regarding when to visit the fertility doctor, which is why couples worried of infertility can come visit at any time. Again, there is no strict answer to this question. However, because various tests have to be done at designated times during a woman's menstrual cycle, it is best to visit a fertility center on the 2nd to 3rd day of the menstrual cycle to receive all tests in a chronological order. 40% is caused by female factors, while the other 40% is caused by male factors. 10% is caused by both male and female, and the remaining 10% is unknown. Female causes of infertility are ovulatory dysfunction, uterine and tubal factors, while male causes include poor sperm quality and structural and functional abnormalities. It is ideal for couples to visit the doctor together so that more than enough time can be given to reproductive counseling. However, if it is difficult, they can always come separately. So far, we talked about the definition and causes of infertility. Now we will go into detail of what tests should be done here at Mariae's Fertility Hospital. First, we have to take some blood tests to evaluate both the ovary and overall health, which is best if done on the 2nd to 3rd day of the menstrual cycle. Hormone tests such as follicle-stimulating hormone, luteinizing hormone, and estradiol best reflect the condition of the ovary when done at this time. Other hormone tests include prolactin and thyroid-stimulating hormone, which can affect the menstrual cycle and therefore fertility. However, for some reason blood tests cannot be done at this time of the menstrual cycle, anti-Mullerian hormone can be tested instead, because it shows consistent results all throughout the cycle. Then, we have other blood tests done at the same time to see if there are any health issues that we need to evaluate prior to conceiving a baby. These include testing for antibodies that we must have. If not, vaccination follows. Second, we have hysterosalpingography. The salpingus is an important structure because it is where the sperm and egg meet and fertilize. Therefore, it is impossible to conceive naturally if both salpinges are occluded, which is why evaluation of the structure is absolutely necessary. We recommend taking hysterosalpingography on the 7th day to the 10th day of menstruation before the next ovulation begins. At this time, chances of being pregnant are very low and the endometrium is thin, making it easier to evaluate both the uterus and salpinges. The procedure is simple and takes only 5 to 10 minutes. First, a thin catheter is inserted into the uterus, through which contrast is injected, filling the endometrium and both salpinges. Then, several X-ray shots are taken to evaluate for uterine anomalies, polyps, myomas, and intrauterine adhesion, and also both tubal occlusion. If this exam shows such results, a hysteroscopic operation may follow after further evaluation. Although some may feel pain, the pain easily goes away after taking painkillers. For women who are sensitive to pain or are worried prior to the exam, they can always take an intramuscular injection of painkiller on the day of the exam for greater effect. Side effects are rare but can appear as urticaria, itchiness, dizziness, and any other kind. Nonetheless, most if not all side effects go away after a few minutes of rest. Women can go home anytime after the exam and return to daily activities. However, vaginal bleeding or discharge may occur for 2 to 3 days, and although we prescribe prophylactic antibiotics, we advise abstinence from sexual intercourse, vaginal douche, swimming pools and saunas for at least 2 to 3 days. Third, we have to take a transvaginal sonography to evaluate the endometrial thickness and ovarian follicles. The exam is repeated at least 2 times during the infertility testing period. The first exam is done on the 2nd to 3rd day of menstruation to check for antral follicle count, which is another index to evaluate ovarian function. The A second exam follows on the expected day of ovulation to check the endometrial thickness and see if the ovarian follicle has grown to an adequate size. The male also has some infertility testing to do as well. For the same purpose, blood tests and urine analysis are done. In addition, an exam for sexually transmitted disease is also done because infection may affect infertility. The most important exam for men is sperm analysis. Although this does not need to be done on a specific date, it is best to abstain from sexual intercourse for 2 to 5 days to obtain the best quality of sperm. After semen is gathered by masturbation, it is analyzed into 5 criteria which we use to assess the quality of the sperm. Today, we learned about infertility and its causes and the tests needed for a diagnosis. Although it is not always possible to find a definite cause of infertility, running an infertility examination helps us find the best way, the most effective way of becoming pregnant. Thank you for listening.